COVID-19, it is a wily foe. It is a dastardly virus. And we've learned that we have to stay humble to it, because it's when we make a move, it makes another move. And its job, obviously, is to overwhelm us, and it does a nice job trying to do that.
The Louisville mayor with his update today on the current situation in Louisville. Hospitals across Metro Louisville right now are being stretched thin, reaching capacity numbers they last saw at the height of the pandemic. Today, Baptist, Norton, and UofL hospitals joined the mayor during his virtual news conference to give us some updates. Kristen Goodwillie tells us that it's not only COVID-19 patients being affected, but also those in need of surgeries.
COVID-19 cases in Jefferson County continue to rise,
with 3,226 new cases last week.
The steep incline inching closer to our all-time highs back in the winter. Last week, Louisville reported 14 deaths.
2 were in their 40s and 2 were in their 50s.
Governor Beshear said this week that hospitals are being stretched thin. That's certainly the case in Louisville.
From a capacity standpoint, I think we're managing capacity right now, but we are very full.
Norton, Baptist, and UofL hospitals all have similar problems. While they aren't completely overwhelmed, they are dealing with numbers comparable to the height of the pandemic.
We had to start backing off on and delaying some of our surgeries because we are, same thing as Steve said, getting pretty maxed.
Here's a quick look at the numbers. Norton Healthcare is nearing peak admissions with 197 COVID patients. 179 of those cases are people that are unvaccinated. Baptist Health is seeing 25% of their cases are vaccinated people, but most of them are much older. UofL Health has 144 COVID patients, and a majority, 137 of them, are unvaccinated.
Clearly, we're seeing an unvaccinated population. It's a younger population.
Both UofL and Baptist Health are delaying elective surgeries to help provide beds to those around the state who need them.
At one point in time, we had 46 requests for transfers into the system from all over the state.
All three systems continue their plea to get vaccinated as medical staff continue to bear the burden of this pandemic.
The system is stressed, but it is far from failing. I think that's the important part to remember, is that we're able to manage this right now.
I'm Kristen Goodwillie, WHAS 11 News.